All right, the next question is about GOLD. Now, GOLD, what is GOLD? Well, when we're talking about pulmonary disease, we're talking about the Global Initiative for Obstructive Lung Disease, GOLD, or COPD. What is GOLD designed for? There's a big international committee that writes out standards of care. And so we can break that down into 3 essential pieces. So GOLD really states that, number 1, we need to make sure our patients are in the right population bucket. By doing that, we ensure that the patient has obstructive lung disease. So most patients in the United States, and not only the United States, but around the globe, that have been diagnosed with COPD have not been confirmed with spirometry. So the first step here in that GOLD pathway is to say, does my patient even have obstructive lung disease? Now, we do that by looking at spirometry, one particular metric that we put a lot of emphasis on. The metric is what we call our obstructive ratio. So FEV1 divided by FVC. So you're looking at the key airspeed divided by the forced vital capacity. Now, we need to look at that not specifically before medication, but rather after medication. We're looking to see, I can't bronchodilate my patient any further. There truly is fixed obstruction. And that helps to confirm diagnosis of COPD. Now, the second principle of GOLD is along those same lines. We're going to take that spirometry objective data that we have gathered, and we're going to look at FEV1. From FEV1, we can determine what the severity or the staging of that patient's disease should be. Are they stage 1, 2, 3, or 4? We're not going to go into the details of what those are, and in fact, most providers actually have a booklet that tell them exactly where those patients fall. The third principle is simple. We're looking at an objective measurement. From an MMRC or a CAT score, we want to see what the patient's symptoms are, what they're perceived at, and that helps us align a risk assessment. I hope that makes GOLD a little easier for you to swallow. Anything in 3s can be digested easily.